Well, good morning. We'll be commencing shortly, just waiting on a few more people to join the webinar today. So hang tight and we won't be long. You can see our attendee numbers climbing, which is great. We'll just give it a few more moments for people to jump in. Well, we might start to get moving. I'm conscious that people are coming in, but we're also on a tight schedule today. So good morning, everyone. My name is Damien Kelly. I'm a client director here at Aon. My absolute pleasure to welcome you to today's conversation. I've spent around about 10 years now in both the health insurance space, helping my clients navigate what can be a bit of a tricky world there. And I also head up our wellbeing strategy here at Aon. And I've been here for around 4 years and spent about 8 years internally at one of Australia's largest health insurers, which affords me great conversations around all things wellbeing, protectionism of employees, etc. So really looking forward to today's conversation. And to that note, what I might do is introduce you to your speakers this morning. And I'm really pleased to be joined by some highly respected experts, both in the field of cancer research and treatment, and also corporate health and wellbeing. So it's a very good morning to yourself, Professor Michael Boyer. How are you, Michael?
I'm very well, Damien. Hi, and thank you for having me.
Great to see you, and thanks for being with us. And happy Thursday morning to you, Jane Gardner. How are you?
I'm well, thanks, Damien, and good morning to you, and good morning to everyone who's listening today.
Great, and thanks for joining us. I am really looking forward to today's session, in particular, some of the presentation that we're going to hear from yourself, Professor Boyer, to begin with, and then the second half of today's session is going to be around Q&A of, in particular, helping our employees with cancer in the workplace. Just a little bit of housekeeping, as always. Today's session is being recorded. The great news from that is obviously you'll have access to this post today's session. You'll have the opportunity to share with colleagues alike. And you've been joined in listen-only mode, but we do encourage questions. So if time permits, what we will do through that Q&A, I've got some pre-prepared questions for our panel, but we'd love to hear from you. So please utilise the questions tab on the right-hand side of your screens to put any questions through. They'll go through to the team and be distributed as we go through the session today. So a little bit of an introduction and a little bit of my perspective on where we are in the world of wellbeing and corporate, and things have certainly changed. As I mentioned, I've been working in health and wellbeing space for over 10 years. Over the last even 12 months, but particularly over the last 10 years, conversations that I have with corporate Australia are changing and evolving. They're much more focused on wellbeing and safety now than they ever have been. In fact, over the past 12 months, particularly as a result of the pandemic, we've been pulse checking with all our clients globally, and three of the key themes that have developed over the past 12 months include employee safety, employee wellbeing, and communications. I'm thrilled that that's the case, because I've always thought that wellbeing is more than just a nice to have. It's a business critical element of any business plan. And yes, it has been accelerated by the pandemic, but I'd contend a well-structured, meaningful, and well-prepared and well-communicated wellbeing plan is critical for business. The numbers are in. There's research available that shares that the benefits to people and companies alike are significant. Employees, somebody with overall strong well-being, is somebody that will create greater profit for an organisation. They'll generate more revenue. They'll have much better customer advocacy and customer retention, and they stick around longer. Not to mention that they're typically ambassadors for wellness internally as well. So the proof points are there. We're not debating whether or not wellbeing plans help people to improve their health. They're absolutely proven to do so. What we want to discuss today is having a meaningful focus on helping our people, our employees, in their time of need. Now, at Aon, a lot of you listening in today would know that we support many organisations insure for exactly these events, for times when people need assistance. What may not surprise you, or may, I'm not sure, but cancer is now the largest cause for claim in our life insurance book here at Aon. And it is followed by mental health. So two of the what has been in the past areas for a lack of communication, lack of conversation, stigma, if you would, within the workplace. And part of today's conversation is to continue to remove the stigma around particularly cancer in the workplace. Salary continuance insurance, which most of you would know about, and other types of life insurance policies, they respond to ensure that people have got the financial support that's necessary for them so that they can focus on their rehabilitation and they can focus on their return to work. And it is a significantly important part of the puzzle for most employees. But what's often missing is a more personalised support to give people access to the relevant resources that they may need, and what can provide them a little bit more control when they're going through a diagnosis or beginning to become a carer as a result of a cancer diagnosis. And a large part of that is supporting employees who are either dealing with that personal diagnosis, or they may actually be friends with colleagues internally and just need to know how to have communication around that, and bringing cancer treatment and survivorship to the fore. And it's a really important part of what we do. So on a personal note, I just thought I'd share a little story before we get into the presentation and Q&A today. I know that on the webinar today, there'll be lots of folks that have got personal stories of cancer in their life. A little over 3 years ago, my sister-in-law was diagnosed with terminal stage 4 bone cancer. Watching her journey through diagnosis to treatments, trying to get onto various trials, and ultimately acceptance that it was terminal was cruel, and it was heartbreaking. The one thing that the community around my brother and his family did was to wrap their arms around Nicole, and obviously my brother and their little boy. My brother was able to take off nearly a year from work, which is quite unique in itself, but he had the opportunity to lean on a fairly strong and broad support network of family and friends, but also allied health professionals. And he was teachable. He was open to therapy. He continues to seek therapy today. So it's now about a year since we've laid Nicole to rest, and both my brother and their little one are doing well. Nick would say in no small part due to the support that he received from his community, but also from his employer. And he says he wouldn't have been able to do this without that. Life's moving forward for them. He doesn't necessarily say that he was lucky, but he knows that he was luckier than a lot. Most people don't have the time, the resources, or the community to be able to be a full-time carer and to be a single parent effectively, like Nick was, for so long whilst holding on to their career. So as I say, I know that there's lots of stories like that out there in the market, but I, for one, I'm energised by the topic, as it means we're focusing on supporting people in their time of need, both for diagnosis, but also as carers, which is such an important element of cancer in the workplace today. And we're focusing on this more than we ever have in the past. So we're going to talk a little bit about how big is the problem, and what is the kind of the state of play to begin with, and a little bit of why is this such an important element for us to be focused on, and what are the numbers telling us. And it gives me great pleasure to help walk us through some of the rates of screening, the detection of cancer, survivorship. It gives me great pleasure to formally introduce our first guest to today's session, Professor Michael Boyer. Professor Boyer, you've been a cancer specialist now for more than 25 years, specialising in the treatment of chest, head and neck cancers. And in 2010, I'd like to congratulate you personally. You were made a member of the Order of Australia for your work as an educator, clinical trials researcher, and for your involvement in the development of the integrated care facilities for people suffering with cancer. I understand you continue to be actively involved in research and focusing on testing of new anti-cancer drugs for the treatment of lung cancer. Now, Professor Boyer, I know that you're going to share with us a short presentation following my first question for you, but if I might start off by asking you a question, if that's okay. For the last 10 years, I understand you've been the Chief Clinical Officer at the Chris O'Brien Lifehouse, which is quite a famous and world-class centre located here in Sydney. Just thought you might be able to share with us how the Chris O'Brien Lifehouse has a different approach to patient care than perhaps some other traditional cancer centres, Michael, and then share with us some more information, if you would, around trends in this space.
All right, thanks, Damien. Thanks very much for the introduction and thanks for the question. I think there are two things that make Chris O'Brien Lifehouse special. The first is that it's a cancer-only hospital, a cancer-only facility. Now, you might wonder, what has that got to do with anything? Like many things in the world, if you focus on one thing, you get very, very good at doing it. And so our complete focus on cancer and its treatment, whether that be with operations or with chemotherapy or immunotherapy or radiotherapy, that focus lets us do things well. And there's abundant evidence from around the world, in fact, that patients who are treated in a dedicated cancer facility have better outcomes. So that's the first thing. The second thing actually is probably more significant, and that is that when we developed Lifehouse, we had a very open mind about how you support patients. So it's one thing to have very good doctors and nurses providing the very best clinical care. It's another thing to put it in an environment that really recognizes all of the support needs of a patient. And so that's what we've done at Lifehouse, and whether those support needs are complementary therapies or exercise or diet or whatever it is, having that there helps. So that's what sets us apart. But I might go on and now talk about why this is a problem in the first case. And cancer is a big problem. So this graph shows you historically, with some projections into the future, the number of cases of cancer, which are the blue bars, and the rate of cancer, which is the orange line. And if you look carefully, you'll see the actual rate of cancer is static, or in fact falling slightly. But of course our population is growing, so what that means is even with a slightly falling cancer rate, the number of cases is growing, and is growing quite rapidly. And what that means, translated into sort of really stark figures, is that in New South Wales, but it's true across Australia, in New South Wales, 1 in 2 men and 1 in 3 women will be diagnosed with cancer by the age of 85. Now, if you stop and think about what that means for any of us as an employee, as a family member, as an employer, it means that we will always be in contact with people who are either dealing with cancer at that time, whose families are dealing with cancer at that time, or who have dealt with it in the past. And so getting this right is really important, obviously at a work perspective, but it's really important, obviously, just in terms of supporting each other and creating the sort of community, Damien, that you talked about before, that was a help to your brother. Next slide, please. Now, the good news, despite the fact that the number of cases is going up, is that survival is also improving. And if you look at the dotted line here, which is all people, the other lines are men and women separately, you can see that over the last 30 years or so, there has been an improvement. It's a bit hard to see the numbers, but at the left-hand end, the 5-year survival for all cancers combined was about 48, 47%. It's now around about 64%. That's up until 2015. We don't actually have the next 5 years worth of figures, although we have some snippets of what's coming out. And we know that that is going to jump up again by another couple of percentage points. So as time goes on, survival is improving. So that's good. Next slide, please. But there are all sorts of inequities that sit behind the number of cases of cancer and the survival. And what you see here is that socioeconomic factors, and these are not medical things, these are how people live, where people live, how educated they are, all those sorts of things impact how likely you are to get cancer. And if you stop and think, why is that the case? We know, for example, that people that have low levels of education are more likely to smoke. Therefore, they are more likely to get cancers associated with smoking. So if you look on the left-hand side of the slide, you'll see that the rates of cancer vary by between 5 and 10%, simply based on your socioeconomic status. Similarly, on the right-hand side, you see that survival varies greatly by socioeconomic status. And again, this is speaking to probably levels of education, levels of access to treatment, understanding the importance of early diagnosis, and so on. So we have to remember that cancer is a problem that transcends all sorts of things, including socioeconomic boundaries. Next slide, please. This is important because it costs us as a community a lot of money. So this is US data, but apart from the fact that the numbers would be smaller, it looks exactly the same in Australia. And you can see here that over a decade, there has been about a 20 to 30% increase in cancer expenditure. And we know this is happening in Australia. So this is a problem that as a community, we need to grapple with. It's so important that anti-smoking campaigns, sunscreen campaigns, all the things that prevent cancer, it's why they are so important. The other byproduct of this, next slide please, is that survivorship, which is something that we really didn't talk about 20, 30, 40 years ago, has become a major topic. Next slide. Now, what do we mean by a cancer survivor? And there is a whole series of different definitions, ranging from anybody that's been diagnosed with cancer and is still alive, being regarded as a cancer survivor, versus people who complete their initial treatment, or people who've been disease-free for a certain amount of time, or people who are alive a certain number of years after diagnosis. For what it's worth, in Australia, the AIHW, so the Australian Institute of Health and Welfare, which is our, if you like, our peak health body in Australia, uses a definition which is a prevalence definition. That is, how many people are alive today who have been previously diagnosed with cancer. So anybody that has had a cancer diagnosis in the past is regarded as a cancer survivor. Next slide. And this is important because the numbers are actually pretty big. So this is data from a couple of years ago, and you can see here in the blue bars the number of people in each age range who are regarded as cancer survivors. And you can see that obviously this is not distributed evenly. It reflects the fact that cancer is a very rare disease, fortunately, in children. It's also a disease where, sadly, if you're very old when you get cancer, you are likely to die from it or die as a result of the fact that you're already in your 80s. But the peak of cancer survivors, you can see here, is in that 55 to 70-year-old age range. And of course, that's important in the context of what we're talking about today, because that is working age. There are a lot of cancer survivors out there who are in the workforce. And if you look at it as a percentage of the population, you'll see, and this will be a percentage of the workforce as well, somewhere between 5 and 7% of the workforce will be in the sort of range of being a cancer survivor. Next slide, please. Now, the data I just showed you was the 5-year prevalence. That is, how many people are alive who have been diagnosed with cancer in the last 5 years. And you can see here that depending how you look at it, there are actually a whole lot more cancer survivors out there in the community. So you'll see here that if you just consider people diagnosed in the last 5 years, it's around about 2% of the population overall. And that's actually a lot if you think that it's 0 for anybody between about the age of 0 and 20 years. So it's 2% of the rest of the population, which is actually a pretty big number. If you look at the 10-year prevalence, so anybody diagnosed in the last 10 years, it's up to 700,000. The 33-year prevalence, and I know it's a pretty random number, that's as far back as the data goes, it's about 1 million people. So out there in the community, there are a lot of people who've been diagnosed with cancer in the past. Next slide. The usual sort of numbers we talk about are that there's around about 750,000 cancer survivors out there, and so that's obviously not going all the way back 33 years. But we know that that number is growing, and it's growing because of two things. The first is, I already showed you that the number of cancer cases is going up, even if the rate isn't. And so if you have more cases, you will have more survivors. Secondly, the earlier you diagnose cancers and the better you treat them, the more survivors you create. Now, this is a problem, but it's a good problem to have because it really reflects the success of modern healthcare in turning people who would otherwise have succumbed to cancer into cancer survivors. So that's a good thing. And worldwide, obviously, the numbers are very, very big. Hard to get accurate numbers globally, but it is in the tens of millions of people. Next slide. One of the things that's been very interesting across my career has been the change in focus of how we approach cancer. And, you know, when I started back 25 or so years ago, really, we were very, very much focused on making people survive cancer. And obviously, we remain focused on doing that. That's an important thing. But as you succeed, the experience of surviving cancer becomes important. And it is fair to say that that is something that until the last 10 years or so has both been poorly understood and poorly researched. Now, in the past 10 years, it has become something that's become both important and increasingly the subject of research and the subject of programs that really recognize that this is a need and that a need that we can address and something that we can actually do better. Next, please. Underpinning some of the problems has been the idea that you have your cancer, you have your illness. We as doctors or we as nurses do something to you that fixes the problem, and then you walk out of the hospital on that very last day of treatment and magically life goes back to normal. Now, anybody that has had any sort of illness, let alone a life-threatening one like cancer, will recognize that that is not how the world works. You don't go straight back to normal for many, many different reasons, some psychological, some physical, and it takes time. It takes time to really come to grips with what's happened to you. And actually, what has been learned in the last few years is that this actually may be a much more difficult time than the time surrounding the diagnosis and surrounding treatment. Next, please. And back in 2006, and this really represents the beginning of this idea of cancer survivorship, the US Institute of Medicine published a report called From Cancer Patient to Cancer Survivor. And this is the first, if you like, high-level recognition that the things that happen to people after treatment, after the end of all the intensive interventions, is actually a distinct phase of the disease and requires distinct and dedicated attention if you want to get the best possible outcomes for that patient as an individual, and of course at a broader level for the community. Next slide, please. The sorts of issues that were identified in that report focused firstly on some specific medical issues. For example, there is an increased risk of cancer. That comes in two varieties. Firstly, the risk of a recurrence of the cancer that you have already been treated for, and that's always been understood. less well understood was the fact that if you've had one cancer, you are actually at somewhat higher risk of getting a second cancer. And on the slide, there are some of the reasons why that might happen. The second sort of medical issue relates to the side effects of treatment. And again, when we talk about side effects, often what people think is that's something that happens when you're having treatment. You know, you have an operation, the side effect is you have pain after your operation. We give chemotherapy, the side effect might be that your hair falls out or that you feel nauseated. And, you know, wait a little bit of time and all of that goes away. It's obvious now that there's a series of side effects that are not short-term ones, that are long-term ones. And again, some of these are shown on the slide that we really need to address. And, you know, you can pretend that they're not there, but then you're not doing the best thing for your patient because you're not really addressing some of the things that may truly be bothering them or truly impairing their quality of life. And one of the flow-through implications of some of these side effects is that cancer patients can have poorer general health because we can create some healthcare problems for some of these patients. So understanding that, dealing with it, and proactively addressing it is important. Next slide, please. But of course, way beyond the medical issues, as you might imagine, there are a whole series of other issues. And these are many times things that if you stop and think for a moment, you'd say, well, that's obvious, but all too often they have been ignored or are ignored. So things like pain and fatigue, the loss of an ability to concentrate, maybe that's a physical thing, but maybe it's just that you're stressed and anxious about the cancer. Emotional fears, you know, the fear of the cancer coming back, the uncertainty that goes along with it, the recognition that you may not live forever, that you're not invincible. The financial aspects of this, you know, if you have cancer, there is no question that financially, as an individual and as a family, you take a hit. And so that's another concern. There are a whole lot of relationship issues, both at an individual level, so your relationship with a spouse or a child or that sort of relationship, but also relationships with co-workers, friends and other family members. And finally, what I'd refer to as existential issues, you know, your outlook on life. You've just been through a sort of a life-changing event, and that may change the way you look at things. Next slide. Now, many of the issues I've just talked about are overcome by people, and you know, people are resilient and people deal with it. But what has become very clear over the last 10 years or so, and the two studies I'm quoting here are from about a decade, a little over a decade ago, but I think the data is a little bit better now, but not much better, is that patients have unmet needs. So people don't always just get over it. And these unmet needs are both psychological and physical, although as time goes on, psychological concerns tend to predominate. So I might stop there, so we'll have plenty of time to talk about some of these things. But I guess I just want to stop by saying that the whole area of survivorship is one of those things that's been there for a long time, just not recognized. And now that we recognize it, it actually puts us in a good place to do something about it.
Well, that's excellent. Professor Boyer, on behalf of our audience today, thank you for sharing your insights. Some really fascinating numbers there. I think personally, just seeing the focus that you as a specialist in this space are having on survivorship is critical. If I might actually just bring us back to that last slide that we're on around unmet needs and just touch on that for a moment, if we could. Yeah. I understand that roughly 40% of people that will be diagnosed with cancer this year, for example, are working Australians. So specifically focused on employers and how they can help. What might be some of the unmet needs of working age patients that are diagnosed with cancer, and how do you believe we can better support these individuals?
So look, the unmet needs, first I should say, vary from, immediately around the time of diagnosis through to the longer term follow-up at later times. But they do focus on a couple of things. Firstly, uncertainty. Uncertainty about the future for that person is a really big one. Lethargy, fatigue, loss of energy is a second one. The third one is a feeling or a sense of loss of control. And then finally, there's straight out anxiety and depression. Now, if you're working in a workplace, some of those things are probably beyond the remit of the workplace, other than just recognizing that they exist, taking account that your employee may not be performing at their top level, but these are things that can be intervened with and changed. Other things actually are very amenable. So, lack of energy, fatigue, that doesn't last forever, but it does last for a time. And so changing work patterns, now of course we're all used to working from home, but in the past, allowing people some flexibility in how they work to work from home, recognizing the uncertainty and the fear that a person may be living with each day, and ensuring that they have the support of their co-workers. And then finally, and this is the really big one, which is a bit of an indictment of how we live, and it was the genesis of all those "Are you okay" day type ideas. Just being there to talk to people. People get scared of actually not knowing what to say to someone who's been diagnosed with cancer. So in many ways, it's easier to say nothing. That's the worst possible scenario. Providing an outlet where someone can actually say, yeah, look, it was a bad experience and I'm still worried about some things, but I'm getting over it. Listening is probably one of the key things we can do.
Fascinating. Thank you so much for sharing, Michael. And I'm hopeful that you'll stick around. We've got a couple more questions that I'd love to throw to you, but we might shift gears a little bit, if I may. And I'll just make sure that I'm sharing something that's relevant here. And yes, I am. Excellent. So we're going to shift gears into the Q&A element of the session. And to begin that, I'm thrilled to introduce you all to Jane Gardner. Now, Jane, putting your photo up would suggest that we'd rather look at that than you live. I love your office. We were talking about that before we started, so we might take that off the screen. But Jane, I understand you are the head of health and wellbeing strategy and also the foundation program lead for Lendlease. In this role, you're responsible for the development and implementation of Lendlease's global health and wellbeing strategy, along with the successful delivery of the foundation program, which has a strong focus on delivering positive health and wellbeing outcomes and personal development. So that's quite a remit. I'm very interested to hear your thoughts, particularly around wellbeing in general in the workplace, which I know you and I share that passion. But more broadly, how is the foundation working? And then we'll get a little bit more specific following that around cancer. So my first question for you relates to the Lendlease Foundation. And I understand it was actually founded in 1983, so you could say it was ahead of its time. In leading the delivery of the foundation, could you just share a little bit with us, Jane, about the background of the foundation and what are some of the initiatives you and your team are working on delivering right now?
Sure, thanks, Damien. So it was founded in 1983, as you said, and way ahead of time for a lot of organisations. Our founder and CEO at the time, Dick Dusseldorp, had a genuine care for people, and he cared for our Lendlease people and their families. So it's not just a remit that supports the Lendlease people, it supports their families as well, because when you go to work, you're away from your family, and it's very important that we ensure that they're all included in this. So it still remains as an operating philosophy today, and we still have a number of programs that we operate within the Lendlease Foundation. I just want to touch on how he set up the foundation, because it's very clever. He set aside a number of shares, and the dividends of those shares funds the Len Lees Foundation. So we always have a budget to be able to care for our people, which is really fantastic. A lot of organisations will say, oh, how do you do this, and how do you get to the place where you've got to? We have no budget, and blah, blah, blah. So we are lucky that we have that. A number of programs that we are working on through the foundation at the moment are the Cancer Aid Coach program. We have launched that earlier this year, and it's been quite successful. We offer bowel cancer kits to all of our people. So I know the Australian government gives them out to people who are over 50, but we extend that to people who are under 50, as statistics are higher in that area. And you are able to get up to 5 kits per person, so you're able to give that to your family, which is great. We do prostate cancer checks on our sites, predominantly male working workforce, so that's where we support them there. Skin cancer checks for all of our people. We have a number of mental health programs that support the mental health, and Professor Michael touched on how important mental health is in the workplace as well. So we have an online mental health induction available to everyone. We have our mental health first aid program, so the standard 2-day program, our 90-minute leader program. We offer the refresher course, and also we have a 2-day for the ageing, because we have a big remit in the retirement living sector. We offer some flagship programs. These ones are global now, our Roadmap to Wellbeing, and that's a 9-module program that focuses on productivity, performance, and positive connections, and mental health and nutrition and sleep, and all those are filtered throughout that program. We have our Sleep Fit program. We know that sleep has a huge impact on your health and wellbeing, so we offer that to all of our people. We have financial wellbeing, given the situation with COVID and people were struggling, some people were struggling financially. We offered a number of programs around that. We have our Uprise program, which is a platform to support wellness and enhance your happiness. We offer mindfulness. We also have a hardship and wellbeing fund for people who have been impacted by COVID and need some financial support. You're able to have a small loan around that. And then there's our generic programs that most companies have, things like EAP, wellbeing leave, and things like that. We offer to the Len Lees families. I just want to touch on this quickly, because there are a number of programs we extend that. So our Sleep Fit program and our Uprise programs available to all of our programs. I mentioned our bowel cancer kits. We have elder care. So if you're supporting an aging parent or an elderly family member, there's some programs to help you support and navigate through that system, as it's quite complex. We have Sleep Fit Baby for our new parents who are struggling to sleep or need some support around that. We have Caring for Kids, which is kind of like a first aid program for children and infants, coping with grief and loss. And this one's been widely used in our US and UK with COVID, and a lot of people have lost a loved one during this time. And we have our EAP, which is extended to everyone as well.
Wow, that's comprehensive, and to say that you have a holistic wellbeing plan is an understatement. That's great. I know that today's session is focused so much on supporting employees when they're faced with a cancer diagnosis, and it's not just the employee who is impacted. Jane, tell us a little bit more about the impact cancer can have on I guess, an employer, so on Lendlease as the employee and the broader organisation.
Yeah, sure. I think the impact is largely on the person. I just want to make sure that I cover that, but definitely from a Lendlease perspective, we want to make sure that we care for our people the best way possible. We want to make sure we support them with resources, how they attend work, whichever way that is, offering flexible work, whatever we need to do, we'll support them. We know it has an impact to the broader team as well. Often people going through a cancer diagnosis may have some physical changes happening in their appearance or with their treatment. They may also need time off for appointments and attend, numerous different appointments for their treatment, and that may have an impact on productivity and on the team itself. So we're conscious of all of those things. So what we typically do is offer that person a member of our injury management team who will help them with their return to work plan, that will also work closely with the team, with the unwell person and their leader, and make sure that we have a solution that suits everyone. I touched on flexibility. We've been doing that pre-COVID. With COVID, that's made it a lot easier. So if people do do need to attend appointments, they can do that. And as I mentioned, we have a number of health and wellbeing solutions that can help also supplement and support their journey through this. So if they need something around sleep or mental health or whatever, we have a program that will support them during this time.
That's great. Thank you, Jane. I appreciate you sharing. Just a reminder for everybody out there, if you've got any questions for Michael or Jane, please shoot them through. We'll endeavour to get through everything today. As I said at the outset, the webinar is being recorded and will be shared. So anything that's not covered, will also ensure that we get answers to questions when we send that around after today. I guess what's really interesting to me, and I'm sure many of the people that are joining us today, is the role that organisations take when it comes to this intersection of wellbeing and workplaces. It certainly comes across that Lendlease absolutely takes pride in its position in helping and managing wellbeing with and for their people. Michael, I might come back to you. At the core of every successful wellbeing plan that I've reviewed or had the pleasure to have an impact on over the years, typically has a simplicity in its solution and its message. And I guess at the absolute core of health are diet and exercise. And I know that nutrition and I know that exercise are also a big part of research. So I understand that there is a lot of research going on, not just at Chris O'Brien Lifehouse, but more broadly. It's being conducted to understand the impact that nutrition and exercise has on cancer. So what has some of the research shown for people diagnosed with cancer, Michael?
Yeah, thanks, Damien. In terms of exercise, first of all, there's actually lots of research that shows that people who exercise live better, live longer, feel better, and have better quality of life. Now, that's a true statement actually across the population. But what is a little more surprising, or has surprised a lot of people, is if you take those people who've previously been diagnosed with cancer, it's actually even more true that you wouldn't have thought that exercise would make you more likely to survive your cancer, but it does. You wouldn't have thought that with all the other things going on that exercise would play such a big role, but it does. And those different bits of research, and as I said, there are many strands of this, actually end up with a series of guidelines for exercise in cancer survivors, which are very similar actually to the more general community. But it's recommended that people do 150 minutes a week of moderate intensity exercise, or 75 minutes a week of high intensity aerobic exercise, plus 2 to 3 sessions of resistance exercise per week. So all the people online, you can kind of try and add it up and see how many of you are doing that. I guess if you've been diagnosed with cancer, you've got a lot of, you're very focused on this, and so that group of people tend to comply with those guidelines much more than the general population does. So it certainly does make a difference, and it's clear that it makes a difference. In terms of diet, diet's a complex one. We know that there are certain dietary things that are bad for us all. There are some that are good for us all. When you get to cancer and cancer survivorship, it's more about maintaining adequate calorie intake, maintaining an adequate balance to one's diet, and often it's about modifying diets to take into account particular limitations of the cancer and its treatment. So as an example, for head and neck or mouth and throat cancers, that the cancer and its treatment often means you can't eat normally. You can't eat the same types of foods that you could before. So diet in that context is all about changing diet in a way that ensures that you get the right things despite not being able to eat whatever it is you ate before. More generally, diet is about the things that all of us, again, know are good for us. Less saturated fats, less animal products, more fish, more vegetables, more grains, and no sort of sweet drinks. And some of those are cancer specific, some are general health specific, and some just contribute to cancers. So, if you are obese and overweight, and remember that diet is the thing that can majorly impact on that, your risk of a variety of cancers goes up. And if you've had a cancer, your risk of cancer recurrence goes up. So getting that right is also important, and providing support to help people do that on an ongoing basis is important, because like many things, we all know what is good for us, or most of us know what is good for us, but actually turning that into a change in behavior, a change in action, is actually the hard bit.
Excellent. Thank you, Michael. Appreciate that. Jane, back to you, if I may. Lendlease is a leader in terms of those holistic wellness solutions that you spoke about for employees, and I understand that you've partnered with CancerAid. You mentioned that just briefly before. Could you expand a little bit for us and just tell us about some of the benefits that this brings to help support employees impacted by cancer in the workplace?
Yeah, sure. So we have partnered with CancerAid. We launched on World Cancer Day in February, and we've had a number of people go through the programs. As Professor Michael said before, there's a lot of people within their working life have a diagnosis. So we were aware of the statistics, and so we wanted to make sure that we supported our people the best way possible. But I want to touch on some feedback. So I reached out to some of the people who had done the program, just so I can give everyone on this call a bit of insight. And the feedback's been amazing. People are telling us it's probably one of the best programs we've offered at Lendlease, and that's pretty phenomenal given the breadth of offerings that we do provide. So I did want to share that today. People are telling us that it's effectively helping them with their health goals. Highlight of the programs are having external support outside of the workplace, away from your family, just having someone to talk to and confide in. So if you're having a bad day, and no doubt you would have plenty of those during this time, you can talk to your coach, and they can help you through that. And then the next time you speak, you've moved on. Whereas if you have that same conversation with a family member, potentially they'll say, oh, how are you going from that bad day? And maybe you don't want to talk about that again. So I think another positive was around the convenience of the CancerAid coach program, which is done over the phone. So you don't have to physically attend another appointment, given that you would have a number of doctor's appointments during this time. And lastly, the information in the app is very factual, and it's a great resource for our people. And they've said to us it's a real positive experience, because no doubt you go onto Google and you read things that aren't as factual as probably what they should be, and that can actually affect your mental health and a few other things. So sticking to the content and information on the app itself was really beneficial to our people. So I just wanted to share what they had said to me about the program.
Yeah, that's great. Some great feedback there. I'm pleased to hear that, Jane. There'll be some more information coming out around CancerAid as we distribute today's webinar after the session ends as well. Jane, I know that for a lot of organisations that are listening in today, and representatives of their teams here thinking about how do they set up frameworks, what would you say is some of the more important elements when thinking about developing frameworks for supporting employees with cancer in the workplace?
I think, well, number one, it needs to be holistic, and you've seen that in what we're offering. What we did in 2014 before we embarked on this journey is we commissioned 2 big pieces of work. And I think to set up any type of framework to support health and wellbeing in cancer, you'll need to understand what your health risks are within the organisation. So our first piece was commissioning a piece of work around understanding all the gaps in our policies and procedures around health and wellbeing. And the second piece was undertaking a study of the health risks of our organisation. And that was done with a large survey to all of our employees. It was also any of our biometric data that we have done with our people in terms of their health assessments. It was a little survey done of every workplace globally, and we have over 700 sites at any one time. So, and it's things like running water that we have here in Australia is not as common in some of our places around the world. And then it was our workers' comp and injury management data fed into that, and it produced a big report, which is when we created our minds, bodies, places and culture pillar. So it's a four pillar approach, and under our minds pillar. We have all of our mental health offerings. Under our bodies pillar is all of our preventative health, and we've just expanded that now to cancer. Given all the statistics and all the information that we've been given, we've really had a big focus on all of our cancer programs this year, and we'll continue to do that. Under our places pillar, it's just making sure our workplaces are as healthy as possible. That's what we do. We build workplaces, so that's probably one of the easier ones to implement for us. And under cultures, we focus heavily on leadership and making sure that we have programs to support our leaders, like the Mental Health First Aid for Leaders program. We have guides and information around having wellbeing conversations. So if an employee did come to their leader with a cancer diagnosis, and as difficult that may be, a leader has guidance and information straight away to give that person. So maybe they'll say, we've got this cancer aid coach program, or we've got some ways to help support you. So our framework is holistic enough that we're able to support the person with whatever they come with us to.
Thanks, Jane. And I guess there's probably not too many firms or organisations in the world that have got such a leadership-led focus on wellbeing as Lendlease, which both is a privilege, obviously, because it's on the radar, but secondly, it's on the radar, so you have to deliver. So it's great to hear your thoughts on that. Michael, I might come back to you. Just one other question, just around cancer detection and treatment. So through your time as an oncologist, what are we seeing in terms of change of detection and treatments in this space?
Yeah, look, so both those things have changed. I mean, detection, I guess in the way you're asking the question, I think you're probably talking about screening. So that is taking the whole community, people who are otherwise completely well, and looking to see if they've got cancer. And so things like mammographic screening for breast cancer, the old pap smears, but now replaced by HPV testing for cervical cancer, the advent of PSA, which is a blood test looking for prostate cancer, highly controversial about how it should be used, but nonetheless is being used fairly widely. The sort of thing Jane referred to earlier, so screening for bowel cancer. All of these things have been introduced in the last 10, 15, maybe up to 20 years. Some of them are sort of national programs, others are a little more ad hoc. The national programs are where there's really good data on which to base it. The next big one that's coming, I think, will be lung cancer screening for people at high risk of lung cancer. That's an important one because lung cancer is the biggest killer. You then talk about how have things changed with treatment. Look, there have been some generic changes. That is, medicine's moved on, and we give better anesthetics, we have better drugs, we have better everything. So that's the generic thing. But the really big changes in cancer treatment have been driven by two things. Firstly, technology, and in the area of both surgery and radiation treatment, the technology has allowed us to do things we could never do before. Robotic surgery is an example where you can do operations with minimal invasion, and in places you couldn't, fit places in the body where you couldn't do it before. In radiotherapy, it's more about the precision of how you can deliver radiotherapy. And in the area I work in, which is in drugs in cancer, two big changes have been the advent of immunotherapy in the last 5 years, which are drugs that actually modify how our immune system fights cancer. And secondly, so-called precision medicine, which is really all about identifying genetic changes within a cancer, not the sort that you can inherit or pass on to a child, but genetic changes in the cancer and only in the cancer, and then using drugs that very specifically target those genetic changes. And that's made a dramatic difference to how a number of cancers are treated.
Michael, a couple of questions have come through. In particular, if we just jump back to that survivorship, there's a question that's come through is why is there not, I guess, a larger focus, particularly in that primary healthcare system of hospital and GP system, to support physical and psychosocial issues in cancer survivorship? Yeah, similar to mental health, it's not spoken about people really are, once treated, on their own. Is it improving? I know that you're obviously on the edge of creating a movement here.
Yeah, look, so it is improving, and I think the honest answer, like for many things in healthcare, is that it wasn't really appreciated as a problem until relatively recently. Relatively recently obviously means a decade now, not just last week. But it wasn't appreciated as a problem, and as it is appreciated, as it is understood, as it is talked about, those things have improved. General practitioners, together with cancer centres, together with employers, all have their part to play in this. And I think that a number of larger cancer centres all now have set up survivorship programs that recognise that this is a distinct phase of the treatment of a cancer, and you rely on the others around you to help with that.
Jane, I've got a question that's come through that I might ask you, if I may, and it's just regarding that relationship. We've spoken a lot today about your holistic approach to wellbeing. The protectionism that you have in place is obviously significant, but there's this relationship between employer and employee. And when a serious diagnosis like cancer comes up, is there an element of permission to offer a program when their employee has a diagnosis, and how do you, I guess, broach cancer aid and the like to ensure that people are seeing that as a protectionism and an offering rather than peering into their private life?
Yeah, no, that's a very good question. I think we're fortunate enough that, as I mentioned, this is embedded into our culture. So it is a culture of care. So just like mental health, we talk about it, our leaders advocate for it. There's a lot of discussion, so people feel compelled to share with them. Similarly, with a cancer diagnosis, we've just started this journey. As I've said, we launched all of our cancer programs in February this year with a lot of leadership support and a lot of discussion and conversation. So we are hoping to break down any barriers that if someone was to receive a diagnosis and they came to their leader would be able to easily say, there's a number of programs for you, including the Cancer Aid program, to support you and help you get through this difficult time. That is the culture we have at Lendlease. And look, to be honest, I think a person would not see it as prying into their private life. The program runs very separate to Lendlease, and we'd be we would advise them of that. But what we would do is make sure that they're as comfortable and as supported as possible whilst they were in our workplaces.
It's wonderful. Thanks so much for that. I know that we're nearing the end of our conversation today. So what we might do is I might ask Professor Boyer if there's anything further you'd like to share with us today. Feel free. Jane, if there's any other thoughts that you've got. It's been fascinating chatting with you both, and we're absolutely grateful for your time. Michael, any last thoughts from yourself?
Look, only to thank you for hosting this and for recognising this is the problem, and recognising that there are solutions to this problem, whether that be via Cancer Aid or any other sort of employee support program. This is something you can influence, and so it's important.
Great. Thank you so much, Professor Boyer, for your time. And Jane, thank you for sharing. We appreciate your transparency in terms of what you do within Lendlease. Any last thoughts from yourself before we wrap up?
I just want to thank you, Damien, as well, for sharing your personal story. I found it was very, very nice to share. And Professor Boyer, your insights into the statistics and all of those things were very interesting as well. But no other thoughts from me. Thank you.
Great. Well, again, on behalf of everybody, on behalf of Aon and on behalf of Cancer Aid, thank you to Michael and Jane for your time. That does conclude today's webinar. A couple of other questions had come in just surrounding how Aon can help, and on the screen here you can see some contact details for how to reach out if there's any help that we can offer in terms of helping organisations with their wellbeing programs. and also a little bit more information around specifically cancer support can be found at our website as well. So on that note, thank you so much for joining us today. A huge thanks again to Michael and Jane, to Cancer Road for your support, and we hope everyone is safe and well. Have a great day. Bye-bye.